Hey guys, what's up? It is your girl, Darshell Smith, Divinely Original D Smith, whatever you call me, baby. And before you do anything, I need you to hit that little red button that says subscribe. And also, when you're finished with this video, or you figure out that you like the video or don't like it, comment on it and click the like or dislike button. And then maybe, once I get your feedback, I can change a couple of things, so then you will like it. Anyways, this video is going to be about 5 essentials for clinicals. And when I say essentials, I don't mean what should you know in clinicals. I mean the things that you need to have in your pockets at all times in clinicals. So without further ado, I'm gonna get into this video. Okay, so my number 5 thing that you should have are gauze pads. Gauze pads. And I usually have some 2x2, and I'll get maybe like 2 or 3 4x4 gauze pads. And the gauze pads are good because maybe you have to DC and IV. You just get one of these little pads, fold that sucker in 4, put it on there, apply a little pressure, pull your IV out, check the tip, put on some tape, bam, you're good to go. Say you're doing an AccuCheck, it's good so that, because you know the alcohol dilates the blood vessels, so they'll bleed more if you wipe it. You hold it with the alcohol after you do the AccuCheck. So you just fold this puppy, put it on the finger, hold pressure while you're waiting for your machine to analyze the results, and then it should have stopped bleeding. But maybe if they're on an anticoagulant, maybe it didn't stop bleeding. And if that's the case, you can tell them to hold pressure on their finger just like this, and you are out of there. Another thing is maybe you need when you're doing wound care. I know there are already some things that you use for wound care, but having a few extra gauze never hurt anybody. Like, come on, really? And also, if you just generally speaking, you might need a gauze pad for God knows what. Like, you can use them for everything, even if you're inserting IV. Like, it's good to have them to put under the hub of the needle, so whenever you get the flashback of blood, it just goes into the needle. I mean, it goes from the needle, not the needle, the catheter into the gauze pad instead of going into the patient's bed or clothes or whatever. I like to put a towel under their arm or hand or whatever body part I'm using, and then put this under the needle, and it works out perfectly for me. By the way, I did my first IV today, and it was awesome sauce. I got a flashback of blood the first time I inserted. Well, actually, it was the second time. I did 2 sticks, but whatever. The first time, her vein blew because she had rolling veins, and it just, I don't know, it was crazy. But anyways, she let me stick her again. That was my first patient. She was so nice, and she was in the medical field, so that made it even better. So she was a little bit more patient with me, and I just adore her. She was such a sweet lady, and her daughter and her children were just awesome. Like, they were like one of the respiratory therapists came in, because I'm on the tele unit. Anyways, the respiratory therapist was just saying, oh yeah, you take such good care of her, and the daughter and the other children were just like, well, she did it for us for so long. And I'm just like, oh my god, that's how I feel about my mom. She took care of me, I'm gonna take care of her no matter how much I don't want to. Like, it's about to go down. No, I'm not about to cry, I'm just being dramatic. Anyways, so that's number 5. So number 4 is the great IV Flush, and this is a Saline. Oops. This is a Saline IV Flush. You can also get the Heparin IV Flush for your heparin locks or whatever. And the difference between a heparin lock and a saline lock, as far as I understand it, is with the saline lock, you just insert saline. With the heparin lock, you actually insert in the heparin flush. So whatever, not that serious. And with the IV flushes, you use it to flush the IV to make sure it's patent, because you want to have a patent IV site, especially if it's in a saline lock or heparin lock form, because you may need that IV for something. You don't know if your patient is going to crash or whatever. My patient that I had yesterday ended up dying last night. So, you know what I'm saying? You never know what's going to happen, or like, you know, how it's going to happen or whatever. Good thing he had his IV, because then they can, you know, push epi and whatever else they got to push. It's also good for right before you give me medication to make sure that it's patent, and then right after to make sure they get all the complete dosage of the medication. So that's number 4. And then number 3 is good old tape. You see this thing right here? This little sucker? Your best friend. You know why? Because you need tape for everything. Whenever you insert the IV, you need tape to stabilize the IV. You need tape. Like, I'm on a tele unit, like I said. And the patients have the leads all over. And it's a 12 lead EKG. Even though it's really 10 leads. That's a whole nother story. And sometimes those little pads that they stick on the patient's chest, sometimes those things come off. Especially if you're giving a patient a bed bath and all that. And you got to wipe their chest and stuff. So you get this good old piece of tape. And you put that sucker over it. Maybe even 2. This one's thinner than I normally get the one that's like, maybe about this size and maybe like half of the size. I don't even know the width. That's ridiculous. It's probably like an inch that I normally have, an inch and a half, something like that. I don't know, who cares. You also can use this good tape. Maybe not this kind of tape, because this kind of tape is clear. But maybe this, well, I've written on this tape too. But okay, you can use especially the paper tape to write stuff on. Like if you have a chest tube and you need to write how many fluid, where the fluid was in the collecting tubes, you can write it right there and you'd be perfectly fine. Like, bam. Or maybe like today, even with my Tegaderm, you know, once you peel the Tegaderm off, there's a little patch where you can write your initials, time, date, size, gauge, catheter, and all that. I accidentally threw mine away, so I got me a good old piece of tape and wrote my stuff on it and stuck it on there. And they don't do that just for the what you call it? They don't do that just for the chest tube or the IV. They got a lot of stuff on tape and stick it on there and they keep it moving. Because that's what a G does. No, I'm just kidding. The next thing on my list is gloves. I don't know if everybody carries gloves around. I get like, maybe like, probably like 10 pairs and I put in my pocket in the morning or whatever. And I might have to go get more. You just never know. Because I have these little sausages that I call fingers. Yeah, so they're always like medium gloves and I need large gloves because I got fat fingers. Thanks, Mom and Dad. But yeah, and you know, like whenever I'm going in the bathroom, I'm going into a patient's room and I'm going to change them or change their IV or maybe mess with their peg tube feedings or whatever I'm doing. 9 times out of 10, I'm putting on gloves, even though I'm just lotioning their feet because I just hate feet. But yeah, so I use gloves for everything. So I make sure I got some in my pockets, and that's our number 2 thing. Last on the list, the most important thing. Okay, it's probably not more important than gloves. Then again, it is. Because they might have gloves in a room. You may not need to carry that on you. But these little things right here, I don't know if you guys can see it. These right here, these alcohol prep bags, honey, I just get probably like an inch worth of these suckers. And I only have, what, 5 or 6 left. And this is from all day. This is like all day today. With the alcohol prep pads, whenever you're starting an IV, when you're giving injections, when you're doing AccuChecks, maybe you're doing venipuncture to get some labs, like maybe you need to clean off the top of the insulin bottle. Like there's like so many things you use this for. This is your best friend. This right here, you use this. And just to recap, you have the gauze, IV flush, tape, gloves. Well, I guess I probably should do this, right? Gloves and alcohol prep pads. And honey, you will be in the clear. Yep. Well, I did a quick video. I have a test tomorrow, so that's me signing off, guys. Sorry. But anyways, as always, guys, happy studying, peace, and blessings. We out. Like, looking at everything, I kind of get overwhelmed. I think that's probably why I folded the sucker in half or something. I don't know.